Eyewitness News presents Newsmakers with your hosts Jane Ann Bugda and Andy Mahalchik.
Hello and welcome to Newsmakers. I'm Jane Ann Bugda along with Andy Mahalchik. The use and abuse of opioids is on the rise across the nation and sadly here at home. The epidemic is destroying families and our communities. And today we're going to take a closer look at how communities can conquer the opioid epidemic. I'll introduce you to our guests, and our conversation will begin when this edition of Newsmakers returns right after this. Welcome back to Newsmakers. I'm Jane Ann Bugda along with Andy Mahalchik. The Family Service Association of Northeast Pennsylvania is preparing for its upcoming conference. Each year they take a look at an important topic that's impacting our community, and this year it is the opioid epidemic, and that is what we will be talking about today, the conference and how the opioid epidemic is impacting our community. Our guests joining Andy and I today are Luzerne County District Attorney Stephanie Salavantis. Amber Loomis is with us from the Family Service Association of Northeast Pennsylvania, and Jason Harlan, the CEO and Director of Wyoming Valley Alcohol and Drug Services. Thank you for joining us today.
Welcome.
Thank you.
Thank you.
This is an important topic because I don't believe that day goes by that we don't report on the opioid epidemic, if we don't read something in the paper, if we don't hear it on talk radio, not only locally, nationwide. So it's important that we, I think, educate our community about it, and that is what's going to be happening during this year's Family Service Association conference. And before we delve into the topic, let's talk a little bit about the Family Service Association for our viewers who may not be familiar. So Amber, explain to us a little bit, what is the Family Service Association of
Sure.
Northeast PA?
Family Service Association, we actually just entered our 122nd year of serving the community. We originally began as a counseling service, and over the years we have grown into so much more. We have 13 programs, and some, just to name a few, include our Helpline 211 program, which is a 24-hour, 7-day-a-week crisis intervention program that we have at Family Service. So if you're looking for heating assistance, if you're looking for a referral, all you have to do is pick up your phone and dial 211, and we will be there to assist you. Some of our other programs include our guardianship program, and that allows us to work with individuals who have been deemed incapacitated by the court. So say someone with dementia, we're able to help them make ethical decisions, you know, to make their lives a little easier. We do a lot of work with at-risk youth, and we recently opened up a children's center in the fall of 2015 in Montrose, and that serves physically and sexually abused children in Susquehanna and Wyoming counties.
And each November, the Family Service Association hosts a conference that takes a closer look at an important topic. And this year, tell us a little bit about this year's conference.
Well, this year we're going to be focusing on opioid addiction, and as you mentioned, each year we like to pick a topic that's really affecting all the members of our community, and as we all know, opioid addiction is making a huge impact on our community members. So we decided to go with opioid addiction, and I know myself personally, I don't really know too many people that are not directly impacted by this issue.
It's really fascinating in that, you know, like Stephanie and Jason and I, we've done stories, and I can't even count how many stories, opioid-related connections, whether it be violence, robberies, sudden death, that kind of thing. So I'll reach out to the experts in the field and say, we're doing this story, can you talk to us? And it's sad to say, I would say the majority of the stories we've interacted with in the last couple of months have been connected to opioids. Let me start off with Stephanie, if I can. Do you think, there's been a lot of programs nationwide talking about this problem. Do you think society's understanding we can't jail this problem away, we can't lock people away and expect it to go away?
I do think that they are seeing this problem differently. I think that for so long people were ashamed to talk about this problem, and this now is a topic that we need to talk about because we are seeing so many lives lost due to this epidemic that we're faced with. So people are starting to talk about it, and people like myself and Jason and Amber and all of these professionals in the community are saying we need better programs. We need things out there, programs out there that will assist these people that are suffering from addiction. And until we do that, we're never going to fix this problem. Jailing people, putting people in jail is not the answer, and that is the message we're constantly telling them. And so programs are a key part of this fight.
How did it escalate so quickly in our communities? It seems like, you know, a few years ago it was something we heard about heroin, then all of a sudden in the last few years that's all we hear about. What made it escalate so quickly?
I think that's a great question. I think there's several answers to that. One of the big things I like to say, our agency says, is heroin, unfortunately, is so cheap now. Our clients are telling us $3 to $4 for a small bag of heroin versus 10, 15 years ago when it was, you know, $15 to $20 in the city. So now the dealers are here. We're doing our best to you know, prosecute them. However, with it being so cheap, that accessibility is there, and I truly believe that's a major reason. And also, too, we live in a society of where we want to get rid of the pain as quick as we can. So, you know, there's a statistic that will be shown that says, you know, the United States population is 5% of the world's. However, we consume 75 to 80% of the world's opiates. That's very sad. So again, that goes back to the fact that the accessibility is there. We have many doctors prescribing it. So I think they're the two major answers right now. And again, I think there's hundreds of other answers. So I think they're the two key answers right now.
And what's really amazing and stunning is, you know, I think many people up until this epidemic had the image of a drug addict, a drug dealer, as somebody shadowy in the corners with a hood up, and they're still out there. But we're covering overdoses in neighborhoods A to Z, black and white, green, everything in between. It's everywhere. And then you realize many of these folks who die from opioid addictions were addicted to it because of a medical problem.
Right.
So it wasn't that they're on the street trying to buy heroin or anything like that. They were out there for the right reason and got addicted. Could you expound on that?
Well, I'll start. We hear a lot of stories of, exactly like you said, where people go to the doctors because they have a back pain or some type of ailment, and they go there and they start taking prescription medication, and these strong medications they become so addicted to, they can't survive without it. And after a while, those medications don't do it for them anymore. So they turn to the streets, they turn to heroin on the streets, and then we see a lot of the overdoses occurring. And it's unfortunate, but like you said, it's not that what people said, the homeless person on the street that may not be that person you typically see in your life. It now is, it touches everybody. It's your best friend, it's your sibling, it's the neighbor next door, and it's not discriminating. So we're just seeing so much of it in such a short period of time that people are now, like I said, the conversation has started and people are really paying attention.
And that's part of what you'll be talking about at the upcoming conference, and we want to remind people that it's going to be held on Friday, November 17th, and it's going to be at Genetti's in downtown Wilkes-Barre, and it's an all-day event, and part of what we're talking about today will be part of what is covered during the day event. So tell us a little bit about the conference itself. Who is it for, and who can join in?
Well, the conference is really for anybody, individuals, service providers, families, community members. We want to encourage anybody and everybody to come to this conference because, as we've mentioned, so many individuals in the communities are really affected by this epidemic, and we want to make sure that we're able to, you know, give everyone all the resources that are available to them. So at the conference, there's going to be 9 different workshops that you get to choose from. I know one of them we're actually doing a Narcan training, so you'll leave there certified to administer Narcan. And we have our opening speaker, we have our keynote luncheon speaker, we have a lot, over 20 organizations from the community that are going to be there with resources ready, and they're going to be ready to answer any questions anyone has about what's going on in our community.
Now, someone sitting at home might be saying, you know, I don't really have anybody in my family who's dealing with opioids, so how does this affect me? How does this affect just someone sitting at home? How does it affect my neighborhood? You know, how does it affect the community? How does the opioid epidemic affect communities?
I think we're all affected in several ways. Our prisons are overpopulated. Our taxes rise because of addiction. Individuals who don't have insurance need treatment, so therefore that's a tax burden. So I think there's so many pieces of the puzzle that addiction affects. I don't know of many people who aren't affected by addiction, whether it be a family member, whether it be a coworker, whether it be a spouse. We're all affected somehow, some way. So for someone to say they're not affected, that just doesn't make sense to me. It doesn't make sense to me at all.
And let me ask Stephanie this question from law enforcement perspective. Again, in the olden days, we talked about, you saw the convenience store being knocked off, homes being burglarized. You thought, well, it's some guy, a dark, shadowy figure, but you're finding out they're so desperate now. The desperation is so great. We're seeing more of those crimes because they need their fix. They need their heroin or opioid addiction to take care of it.
Absolutely. I typically use the stat of about 80%, 80 to 85%, and I think I'm being conservative giving that number, centers around addiction when it comes to our crime rate and what we're seeing in our office. So we're seeing a lot of parents being robbed by children or family members that know that they may have nice jewelry in their home, and they do it exactly like you said. They do it because they don't mean ill will towards them. They just want to feed their addiction. And they're stealing just to get that money, even if it's $5 to get that money so they can get the drugs on the streets and get their next high. And that's what we're seeing a lot of, the burglaries, the robberies, aggravated assaults, all of these, and violent crime centering around the sale of drugs and territory. So it all comes back to drugs and either the addiction side of it or the selling of it.
If I can, I think, at least anecdotally speaking, when the photograph went viral nationwide of the parents, and they weren't dead, they had overdosed, they're in their car leaning back, and there's kids in a car seat. And we had in Hazleton a young couple dead or overdosed with the kids in the house. Do you think that was a wake-up call? They're the kind of images that people said, wow, this is happening in my neighborhood.
I definitely think, for going back to how is this affecting our communities, that's how it is affecting us. And that is one picture, but it happens so often. And you really can't fathom how often it really happens, because you think we live in this perfect world and how could this possibly happen? But that, it's going back to, and Jason can speak more to it, but it's going back to the addiction. They're just looking for their next high and to get that feeling, and that's the only way they know how to survive.
And I think that's a great point that Stephanie, makes, is we have to remember that opioid addiction is a physical addiction as well too. So I like to make people understand the fact that multiply the stomach flu times 5. That's how you feel when you don't get your opiates if someone's physically addicted. So that's a major issue. It's a sickness.
And from a drug addiction perspective, there's no such thing as saying I'm going cold turkey and I'm going to stop. Way back when Nancy Reagan said, just say no. Say no to starting it, but once you start,
right,
your body craves it. It takes over your life. It is your God.
That's exactly right. It controls everything. We see thousands of people a year, and by far, heroin is one of the most addictive drugs that exist out there. Most people who try heroin the first time become addicted shortly thereafter. So it's Russian roulette. That's what it is.
One of the interesting topics that you're going to be discussing during this family conference was the use of opioids in seniors. And that really took me by surprise, because that is something I don't think I even thought about when I think about our senior citizens population with opioids. Can you explain a little bit about that? How is...
Sure. I think we can all agree as we get older, we feel more aches and pains. So, obviously any human being wants to get rid of that pain as quick as they can. So a lot of senior citizens may be on more medications than younger population. So they're more exposed to the possibility of addiction. It's not uncommon. I can remember my grandmother having multiple medications in her medicine cabinet. So it's a generation too where there was no problems. At least people didn't think there was problems with prescription medication, when in fact prescription medication is the start of a lot of problems to other issues as well.
And it goes to another level too, where some of our senior citizens are financially strapped, and they look for ways to make an extra dollar. And because they have all these prescription medications, we're finding that a lot of them are selling their drugs.
Right.
And that allows them to actually make some more money for their survival. So you're seeing it on different levels.
Well, we are going to continue our conversation today about the Family Service Association's upcoming conference and the opioid addiction that is plaguing our communities. You can find information on today's show on pahomepage.com. We are under the Newsmakers link. You are watching Newsmakers. We are a proud recipient of 2 Pennsylvania Association of Broadcasting Awards for excellence in public affairs programming. And we'll be right back.
Welcome back, and you are watching Eyewitness Newsmakers. We are talking today about the opioid epidemic. We've all heard about it, and if you're thinking it doesn't affect you, guess again, it is. Somewhere it's affecting your neighborhood, a family member, a co-worker, if it hasn't already. We have as our guest Stephanie Salvantis, Luzerne County DA, Amber Loomis from Family Service Association, and Jason Harlan, our good friend from Wyoming Valley Alcohol and Drug Services. We're talking about a conference coming up later this month at Genetti's in downtown Wilkes-Barre, talking about the opioid addiction epidemic and what we can do about it. People hear about Narcan. Let me talk about Narcan. And some are calling it a miracle drug because it reverses an opioid overdose. Let me go first of all to Jason. What is Narcan and how does it work?
Narcan, as you mentioned, is a medication, as you call it, the miracle drug that reverses an opiate overdose. I think Luzerne County had over 140 overdose deaths last year, and just imagine what we would have had if we didn't have Narcan available. It saves lives, that's what it does. The good news is there's a standing order in Pennsylvania where anyone can access that from their pharmacy, whether it be through their insurance company, a simple copay. Exactly what you said, Annie, it's a miracle drug. It saves lives every day.
It's also known as naloxone.
That's correct, naloxone as well.
And Stephanie, what are you seeing with the drug?
Well, I have been working with the Pennsylvania District Attorneys Association, with the Attorney General's office, with many different organizations, Pennsylvania Water, CVS, so many different organizations that are trying to put this drug in the hands of people that can save another individual who is overdosing. So we have worked hard to put Narcan in the hands of all law enforcement, our emergency response teams, even reaching out now to schools and universities and campuses, because we're seeing this happening everywhere. It's not in any specific neighborhood. This is happening everywhere. So we're trying to reach out to everybody we can and get it into their hands. So if someone is overdosing, they can help them and save their lives.
Now let me ask a question about Narcan. If someone is administered Narcan, should there be some guidelines set in place that after they've been administered it and they've come back that they should go into some sort of rehabilitation program? Are there any guidelines set up that way, or should there be?
I definitely think there should be. There has been talks about a law being put into place, requiring somebody to enter a rehab if they do overdose and Narcan is administered. We have to remember that Narcan can be used for prescription medication as well too. Everyone thinks Narcan is just for heroin. It's not. There's a lot of people overdose on prescription medication. So yes, I think there needs to be some kind of guidelines as far as somebody entering treatment of some sort.
And feeding off of Jason, law enforcement seeing that in a weekend we could be using Narcan on the same individual numerous times. So it's my opinion that we do have to have something in place that once that is administered to them, that we provide them with some type of treatment, because that will be the best moment that we can try to get these individuals the help they need. And as Jason stated, legislators are talking about this a lot these days, and trying to do as much as they can to help these individuals. So I'm very grateful for that. This is a conversation that we need to continue to have.
And anything good can be perverted or turned around. Law enforcement has told me, and Stephanie and you guys probably have heard this, that just like the designated driver,
Yeah.
there are people who have parties or drive around,
Yes.
and they have a designated Narcan administrator. They know they'll take the highest dose of drugs they can get, knowing that my friend in the back seat or in the front seat are going to give me a dose of Narcan and save my life.
It's sad, but that is reality these days. And in my opinion, based on what I've been learning, it's because they can reach a certain high then to the point where if they do die, they'll be brought back, and
Right.
that creates an even bigger high for them. It's amazing to me how everything works and what people will do to get that feeling.
And sad to get to that point.
Yes.
And
It
I
is.
think, and see if you agree with me on this, you know, we started, even as a young reporter, you covered the big drug busts, and you lock them, throw away the key, whatever it was, get tough on drug dealers, and you have to. We don't condone anything. But I think there's more understanding now to treat the addiction. Those who aren't necessarily the bad guys, but they got into something they cannot control. And it's taking over their life, and because it's taking over their life, it's impacting all of us. Ripple effect.
Right. And we're seeing that people are selling to feed their addiction too. So on top of being a person who is suffering from this, they are also selling and creating maybe that effect for someone else. And that's just to feed their own habit.
What type of toll does an addiction take on a family? You know, you'll be discussing this too, and that's...
I think that's a great question. As a matter of fact, myself and one of my coworkers are doing a seminar at the conference on family. I have addiction, many people I know, and in most instances, the family member is just as sick as the addict. They have to go through treatment as well to be successful. As Stephanie mentioned earlier, individuals addicted rob, they steal, they lie, they manipulate. So family members are affected just as the addict is. So that's a great question.
And I do want to also mention that in addition to the conference on November 17th, they're having a kickoff to the conference, which is the evening before, and it's open to the public and free. So tell us a little bit about what's going to be happening that evening.
Yes, it's the night before the conference, our kickoff event, thank you. And we are going to have Alexis Johnson, a really wonderful young lady. She is currently a fitness model, great, lovely lady. And she went through many years of battling with addiction. So she's going to be able to come and really tell her inspiring story about everything she went through and how she got to where she is today. And she's been in recovery for a few years now, and we're going to have her there speaking, and we are also going to have Judge Sklorowski will be present, and he's going to have a panel together and with some different community members that are going to be talking about the opioid crisis and how it's affecting the community and what we can do as a community to really start trying to make a difference.
Okay, Jason, quick question. Is there help out there? Somebody's watching at home now, and maybe they had a close call with an overdose. They have a loved one or a friend, they don't know what to do, and they're thinking, there's no way, I hate to say magic pill. What can be done? Can someone come to your agency or the many great treatment centers we have out there counseling and say, help my loved one, help my friend? Can it be turned around?
Yeah, people are getting better every day. We need to understand that. There's a lot of help out there. We live in a county that has a lot of qualitative treatment there. A lot of outpatient treatment available, medicated assisted therapy for people who meet that criteria. A lot of good inpatient rehabs as well too. So there's a lot of help for family. There's a lot of help for the addicted as well. So yes, Annie, there's a ton of help out there.
Real quick story. I called Jason one day, we were doing a story on the opioid situation. And we are driving to his office, and we're texting back and forth about setting up the interview. How many times have I gotten there and come back in an hour and a half, I have a crisis, come back in 2 hours, or I can't do it today? Because that's how it's every single day.
Right, consistently.
Amazing.
It's consistent. So it's just a sad, depressing situation, but it will get better. It will get better.
We have about 3 minutes left. Can we break the cycle of addiction? Can it be broken?
I definitely think it'd be broken. I mean, if you look at history, you know, we had the cocaine epidemic, we had many epidemics in the past, the methamphetamine epidemic, and we overcame it to an extent. First thing we need to do is defeat that stigma. People need to be educated about addiction. They need to be open-minded about it. I think that's extremely important. Without that education and that stigma being approached, we won't get better, so that's what we need to do.
And as DA, what would you say to that?
I agree with Jason. I think it's one day at a time, all of us working together. as a community, really. It's a community approach, and that's what I tell people everywhere I go. We need to work together as a community. It can't be law enforcement's responsibility or counseling or these different agencies' responsibilities. It has to be all of us working together and making sure that we do get rid of that stigma and say we are behind you, and whatever we can do to support you, we will.
And Amber, really, we'll come full circle, go back to the conference. Where is it, when is it, and what will it entail?
Okay, well, we'll have the night before the kickoff event on Thursday, November 16th. We'll have our speaker, Alexis Johnson, and a panel with Judge Sklorowski. That's free and open to the public, so we encourage everyone and anyone to attend. And then our conference will be on Friday, November 17th at Genetti's. Kickoff event will be at Genetti's as well. And it's going to be a really informative, educational day. We have our opening speaker, our keynote luncheon speaker, attorney Lori Besden, who's going to have a really impactful, powerful story to tell everyone that attends. Multiple different workshops to attend. Continuing education credits are available, and you can register by calling that number on your screen or by going online to our website.
And we do want to remind everyone that we have links to Family Service Association on PAHomepage.com. We also have Wyoming Valley Alcohol and Drug Services, also on PAHomepage.com, and information that you've heard today will be there as well. We want to thank you all for joining us today,
Thank
and we
you.
want to encourage everyone to attend the events and register for the event on Friday, but we welcome the public to the event on
Definitely.
Friday to learn more. And thank you for your hard work every day in our community. For Andy Michalczyk and everyone behind the scenes, I'm Jane Ann Bugda. We want to thank you so much for making Eyewitness Newsmakers part of your day. Check us out on PAHomepage.com, and we'll talk again next time.